My name is Allison Rollins, and I am super excited to share with you guys tonight about natural newborn care. I am a doula, have been so for almost 20 years, and I'm also a certified health coach. So I love, love, love helping families to navigate both pregnancy and birth and the postpartum. I really feel like it's important to help new families be able to understand what their options are as they're having their first babies, and then families who are having their third, fourth, fifth babies to be able to offer them lots of support and love as they're navigating bringing a new baby into a family of other children who also have lots of needs. So let's see. I'm going to pull this up real quick if I can find it. Okay. So thanks so much for checking in with us tonight. I'm having a little bit of technical difficulty. Goodness, sometimes things work in our world of all this technology, and sometimes it's just not working. So thank you so much for your patience. I hope that you've been able to get connected with some of our other resources. We have a wonderful array of blogs for parents, partners, and dads included. So definitely always check out our website. We have tons of different blog posts that may be something that you're really having questions about or we're concerned about. So, all right, I think I'm almost there. So welcome on this evening. I am, again, the co-owner of High Country Doulas, along with Samantha Lee Wright, and we have a lot of wonderful doulas who are on our team, and they love to help support mothers and partners with that journey in that first year of life and pregnancy and birth. So, all right, well, welcome everyone. Tonight's webinar is on natural newborn care, and I hope that you walk away with some more information that can help you make the decisions that you want to make that are right for your family and your baby. So again, my name is Allison Rollins, and I am a certified health coach and a doula. I really absolutely love helping families who have that desire to understand more about their choices, whether that is medical or natural. And I'm really motivated to help you and your baby to be able to have that optimal health, make the best choices that are right for your selves, and ultimately benefit you, both of you, in the long run. I have 3 wonderful children of my own who are big and grown and all taller than me, and a wonderful husband. And I love for people to reach out to me if they have questions. So feel free to email me at info@highcountrydoulas.com. I love to be able to help you get resources for the questions that you have and help you feel better about those choices. So I'm not a provider, and I do encourage you to check out your area providers to see if they offer natural or alternative choices, if that is something that you're seeking for your baby. And if you have any questions during our time together, feel free to post them, and I'll do my best to be able to respond to those if they don't get answered in the time here. All right. So thanks again so much for being here. I do have a number of resources that I used for this webinar, and I will share those when I send out the follow-up email for you, so you can take a look at all those and be able to do your own research that you need to. Awesome. So natural or holistic care for newborns. So really, while many aspects of holistic or natural healthcare are still being explored and improved upon every day, there are certain things that are universal. And encouraging healthy choices for both parents and babies to introduce an elevated level of health and well-being into their lives is really the goal of exploring tonight's webinar. Most healthcare professionals who tend to be more centered in treating patients and preventative model rather than illness. Now, treating the body and the mind really encourages more optimal levels of health before the onset of illness, and can likely reduce developing various illnesses or diseases down the road. Even it is more important. So thinking about that, just thinking about treating the whole person. Parents who choose to learn what can be the optimal choices for their baby are really automatically kind of seeking that to create that foundation of health and wellness for their child from the very start. So today we'll really be talking through various things that you can do and practices that can help you prevent the onset of any illnesses, both in your newborn and in yourself as a parent. So please just take time to be able to think about what is important for you and your baby, and think about what maybe doing some checking in with who you'd like to be your baby's provider. And also, just sometimes we don't have a lot of options, and so we don't have those types of options. But I think being able to have those conversations with providers, asking the right questions can be really key in being able to get to the root cause of what's going on with your baby and any issue that you're having. So I always encourage you to have those conversations with your providers. All right, so those first moments, skin-to-skin contact with your newborn as they emerge from the womb is often the very first thing that I do as a doula, and a lot of providers are now doing, to encourage you to welcome them into this world. Really, the modern healthcare system has altered that natural course of birthing, which welcomed babies into the world for so long, basically from womb to arms to chest. And these changes are being reversed as we have learned the impact to both mothers and babies. Babies are sometimes still taken from mothers immediately following birth for tests or medical procedures, kind of reversing that human connection and skin to skin. But connecting mothers with their child will really ensure that human connection that is maintained. And they've spent 9 months connected, a part of you, and as quickly as you can get them up and connected with you, with your voice and stuff, this is a huge, huge impact to a good start for your baby. And there are instances where if baby is not doing well or needs some respiratory support or other support, that this might be interrupted. But I encourage you to, if that happens to you for your experience, to know that you will still be able to have those moments and you can still have that skin to skin and that bonding time. So don't worry too much about that. But a mother's skin and a natural touch does help really to regulate baby's temperature. Babies, when they're first born, are unable to regulate their temperature, so we're kind of like their natural heater. And they also aren't really, they just have their first breath, so they can't really regulate their breathing as well and their metabolism. So moms act as this, and this advantage is really huge, ensuring that the child will grow and maintain good health, regulating all major shifts. So it's just a wonderful thing that we can do to ensure that positive beginnings with our babies. So awesome. All right, natural childbirth. Some of you may have already decided that you're interested in having a natural childbirth. In many states and countries, and in our area, a lot of low-risk pregnancies are often given the option to give birth naturally if that's what you wanted, either in the hospital or in some areas, home birth. Natural kind of minded healthcare has really presented strong arguments for the benefits of giving birth naturally for mothers who are low risk. So I encourage you to come out and take our birth course. We love to talk about natural childbirth and experiencing that, because we all know that at some point in our labor, you're going to be laboring naturally for a while, regardless of if you want that epidural later. So it's really nice to have the tools to be able to know how to handle that both emotionally and physically, because that journey is equally both of those. All right, so let's talk a little bit about breastfeeding. A lot of moms and dads are really excited to be able to offer and provide their babies with breast milk. And breastfeeding is one of the most natural and ways that we can give our baby their best beginning. So breastfeeding is considered the most beneficial thing really that a parent can do to ensure a baby's health. Sometimes moms are unable or don't have the support to continue breastfeeding, but I hope that if you are struggling with breastfeeding in the postpartum in those early days, know that your success often depends on connecting with the right resources. So at High Country Doulas, we love to be able to provide you with that hands-on in-home breastfeeding support with our doulas. And if we don't feel like it's something we can handle, we definitely get you connected with the right resources, whether that's an IBC-LC lactation consultant that can also help you. We do help support a lot of moms to be able to breastfeed and troubleshoot those early weeks and days, because it's challenging. You just don't know what to expect. But breastfeeding does ensure that your baby gets a maximum amount of nutrients that are really easily assimilated into their body and almost all absorbed. So they have those wonderful nutrients and antibodies. Other kind of effects of breastfeeding that you may or may not have been aware of include loss of iron. So during pregnancy, iron supplies and amenorrhea, or absence of the menstrual period, is normal for women. And women who choose to breastfeed exclusively after birth lose more iron than those who don't. So the absence of menstruation is lengthened. So oftentimes women who breastfeed will have that menses delayed even further as a breastfeeding mom. Now this does depend on person to person, and I always want to tell couples that breastfeeding is not a form of birth control. It can make us less fertile for some moms, but we can cycle and release eggs without bleeding. So it's really important that you know that, and definitely talk to your healthcare provider. There's a wonderful website. It's called bedsider.org that has a great chart about all the options for that, if that's something that you need to check out for yourselves. It's always good to check out before you have your baby. So so this is lengthened. And then another thing to note with this, as a breastfeeding mom, you do need to include very iron-rich foods in your diet, or like a whole foods iron supplement. Our bodies are much more likely to assimilate and absorb more of a whole foods iron-rich supplement and just a whole foods full of iron than we are more synthetic iron. Our body doesn't often know how to process it or what to do with it. So that's another option that would be more of a natural choice for you all. Your baby's immune system can also benefit most when you choose to breastfeeding. It just helps them fight off viral, bacterial, and parasitic infections that they might come into contact with. Babies are born with sort of a sticky tar-like substance called meconium that is in their intestines, sort of that first bowel movement that has built up within their bodies. Colostrum, which is the first milk, is uniquely designed to help move this substance through the infant's body. So it has sort of a laxative type effect, and it helps to ensure that baby gets rid of the meconium, which can, if not removed, can lead to jaundice. Breast milk is designed really as the perfect food for your baby. It also contains enzymes such as amylase, which allow it to absorb more effectively. It's just more naturally designed than other types of supplemental milks the baby can have. So next, we're going to talk a little bit more about healthy diets for breastfeeding moms. So I know you guys are all eating all this wonderful food, just like in this picture. Some nice healthy fats from avocados, some quinoa, some chia seeds sprinkled on top. Got some oranges, apples, and nuts. And I think that was pomegranate in there. So this looks really good. It's making me hungry. So yeah, it's really important to think about a healthy diet. And we really start with that in our prenatal period. As soon as we find out we're pregnant, we tend to be more aware of what we're putting in our bodies. And really, I think the key to consuming a healthy diet is to look to more whole foods based, less processed foods. Our bodies kind of know what to do with those foods, and it just is a more natural. It also includes a lot more fiber than processed foods, and our body really needs fiber. One of the main reasons that comes to mind for pregnancy for fiber is that oftentimes women can get constipated, and this can be due to our hormones shifting in our body, which kind of slows down. We have this hormone called relaxin, which kind of slows down and makes our body more stretchy. And sometimes that can also have effects on our digestive system. Another thing that often happens is a lot of times our prenatal vitamins have a synthetic iron in it, and that can really cause stagnation in the digestive system, which can unfortunately lead to things like hemorrhoids, which is really a painful thing to have to go through. So if we have that nice fiber, the soluble and insoluble fiber in our diet, our bowels will stay more regular. Of course, if we have those without adequate hydration, then that can be an issue. But there's lots of different things that you can do to ensure that your digestion stays healthy. If you have any questions, I love supporting moms with prenatal nutrition. So definitely reach out if you are struggling with anything like that. Awesome. All right. Let's talk about soothing infants. So really, one of the most important things that I mention when I teach expectant parents, especially first-time parents, is the fact that, like, as a society, we really are not around newborns. So we're not super familiar with how to soothe them and make them feel better. And there's really a period of 3 months following birth that's coined the fourth trimester. There's a bunch of books out there called the fourth trimester. There's something called the fourth trimester theory. I encourage you to read more about that. But during this time, an infant's senses and movements and reactions to the world around them are more responsive to the inside conditions of the womb than to those on the outside. It's almost as if this really takes sort of a long to fully transition. They take a longer time to fully transition to that outside world, and really to get used to taking up more space and their own new external conditions. Some babies transition smoother than others. This has to do with a lot of different factors, but if your baby is having a hard time transitioning, from the womb to outside. We're going to talk a little bit about the things that you can do that might help them. So for this reason, many professionals, such as myself and other professionals, really recommend that new parents soothe and pacify their baby using similar conditions during this period. So swaddling, soft touch, snuggling, keeping them warm, using natural movements like swaying is most effective when trying to soothe them. And so if you consider it, in the womb, they've never really ever been hungry. They've never been cold. They've always been gently rocked. So oftentimes babies are born into sort of this space of fluorescent lights, different noises, feeling cold. All of a sudden they're starting to feel hungry. And so as much as we can, we're going to try to help support them in that transition. So we're going to talk about different ways we can do that. So the rhythms that they experience in the womb will trigger baby to relax. Those of you who are pregnant right now probably notice that when you are active, your baby doesn't kick or move as much. When you tend to sit down, or maybe when you lay down at night, you'll all of a sudden start getting all this movement in your belly, and your baby is just like, hey, oh, okay. So they're no longer kind of rocked to sleep. And so emulating these rhythms really serves as a sort of natural on-off switch for upset newborns. Sort of these seemingly what we call random effects of rocking baby back and forth, taking them for a drive, to soothe their cries, actually sort of emulates this gentle movements of being inside the womb. So really, newborn care specialists really advocate for simple techniques. So in order to clarify these, Dr. Harvey Karp wrote a book called the 5 S's, I believe. So you know, the happiest baby on the block, but it includes the 5 S's. So these are a couple of them if you haven't already heard me rant and rave about these. So number 1 of the S is swaddling. 2 is side or stomach position. 3 is shushing. 4 is sling. And 5 is suck. So I'm sure you've heard that the babies naturally have a need for suck. So we're going to talk a little bit more about these 5 S's. So the first one being swaddling. I'm sure if you've done any perusing for your baby, you've seen all kinds of devices to be able to swaddle your baby. You probably heard people say, oh, my baby swaddled all the time. I never swaddled my baby. People love to give parents advice, as you know, even before you ever or get to meet your baby. So swaddling really helps your baby feel that tightness like they felt in the womb, that pressure from the water that they felt in the womb. They really love that feeling. They've been just tucked away for 9 months, and it's a natural thing that they might crave this. I will say that a lot of parents will tell me that my baby didn't like a swaddle, and I always encourage them to try different types of swaddles. YouTube has a lot of different swaddle videos that you can look in. And babies that are fussy and sleepy are going to fuss anyway. So oftentimes they're really not fussing about the swaddling. They're just fussing because they feel something and they don't know what it is, but it's really that they're tired. So swaddling can be a great tool. And as a doula and doulas in general often help you make those transitions and help you to kind of understand what your baby's trying to tell you, helping you understand the cues that your baby is having, and helping you be prepared to kind of have specific strategies in place to make that time a little smoother. So swaddling is really important as an aspect. It also keeps your baby warm and can help them sleep. It also decreases their likelihood that they're going to startle themselves awake. So one of baby's newborn's reflexes is called the startle reflex. And it's a natural instinct for them to grab when they feel like they're laying on their back or they're falling through space. And if we know that safe sleep is really for babies to be on their back to sleep. So in order to do that, we use swaddling as a way to ensure that they do not startle themselves back awake when they're still really tired. It's really important for them to get adequate sleep. We definitely, to swaddle correctly, you want to wrap the arms tightly, much tighter than you probably think that you should. I would say that this baby is not swaddled really well. Not the best swaddling. His hands are out and he's probably going to break out of that. Some babies are like Houdinis, so you have to get really tricky. There's a good swaddle technique called the pocket swaddle that I often show in our early postpartum class that I teach. So just ensuring that baby is swaddled tightly, making sure that the swaddle edges of a blanket come right over the shoulders, but not up into the face and chin area, and tucking that unloose around. Now the lower half of the body, the hips and stuff, really don't need to be really tight. It's really that upper torso that will help them really calm them down. So there's, I hope you get to come to my class and I'll teach you all about swaddling. So the second S is side or stomach. And while the back, of course, is great for sleeping, settling your baby on their side. So when you're calming them or rocking them, settling them on their side or their stomach can have really help help to calm restlessness or sort of unsettled behavior. It's really good if a baby's overtired. So if you've gone past your baby's nap time, that side or stomach, and oftentimes this is going to be with their head, of course, facing out from you. You can also pat their back or their bottom while you're doing that and sway at the same time. And then, of course, placing your baby on back when they actually do fall asleep. So that third S is shushing. In contrast to really what you might think, babies don't need total silence to sleep in. And so, in fact, they have been listening to the noise of the blood flow and internal activities inside you during pregnancy, which can equate to about the noise level of a vacuum. So I see parents and they're like, shh. And I'm like, no, 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 no. It's like, shh. And to really maintain that for a long time can be hard. I know, because I've postpartum doulaed overnight with babies, and I love like shushing machines or noise machines or apps on my phones that I can get that same sound and not like run out of breath. So they make little different things that you can purchase as a parent to be able to do that. You can get apps on your phone or on your tablet. You can use box fans, overhead fans in your kitchen. There's lots of different options, but sometimes it really doesn't take a long time at that high level to really get baby to calm and settle into sleep. It is an amazing tool. So the fourth S is swing. Similar to the swaddling sensation of completely enveloped by the womb, being inside of another human being involves a great deal of involuntary moving around and jiggling. And those natural kind of movements that you've been taking during pregnancy might well be effective in soothing a distressed newborn. So supporting the head and neck while jiggling the body in a very small, gentle movements. Sometimes people use the birth balls that they have. Dads really like to get on birth balls. They're naturally the best swaddlers, and they can really soothe babies. They've got all their tools. And then the fifth and last one is suck. So I always tell parents that using pacifiers for suck is sort of like a choice that you have. You can do it if it helps your baby. Babies all have different levels of suck. Breastfed babies often really don't have as much suck need because they get more at the breast. But I will say that there is a trick to getting your baby to learn how to take a pacifier if that's what you want. So Sometimes that is a little bit of training for some babies. Some babies just have a hard time doing that. The doulas are really good at helping you kind of like figure those little tricks out. So pacifiers can be soothing aids. Dads and moms, you can also use your finger. So a clean finger inserted with the pad up to hit that very roof of the baby's mouth is where you're going to trigger that suck reflex. And on the fly, it's a great tool to be able to support your baby to have sort of a calm, natural soother. Awesome. So you are all set with the 5 S's to help your baby calm down and settle into sleep, and or sometimes to settle them back in to try again with breastfeeding. When providing care for your newborn, it really helps to kind of be aware of their sensory and cognitive abilities, and really also to maintain this awareness as they develop. So sight. Newborns have about a vision from 8 to 12 inches in front of them. Is in that first couple weeks. And as their eyes are sensitive to light, it is best to sort of keep lighting low and colors bright or white and black to help encourage and clear vision and strengthen their attentiveness. Hearing. Babies are accustomed to hearing a multitude of sounds when they're inside your womb. Yet these are sort of automatically accompanied by a natural muffling sort of noise. So this means that sounds outside of this environment will naturally sound several times as loud as anything they've ever heard before. So oftentimes babies are totally not caught off guard with natural talking noises or, things frying in the pan. But if it's a piercing loud, like a dog's bark or a siren or a slamming door, then that will definitely cause them to startle, and they have to kind of adjust to those things. So taste. Newborns favor sweet taste and smells over sour. And although taste buds continue to develop over the first year of life, this will generally remain the case. So as an infant feeding specialist, I also encourage moms to understand that what you eat will create flavors for your baby, and they will get to taste lots of different flavors through the breast milk. If you eat a lot of garlic, your baby's going to taste a lot of that. So babies born in different cultures are really going to have a taste for what that culture's normal diets are. So they may be in a culture that has a lot of spicy foods, and so when they start introducing solid foods, they're going to be more accustomed to those flavors. It's pretty cool to think about. All right, so touch. Highly sensitive to touch and temperatures. So this is one of the things that is really awesome in a lot of ways, because we can soothe babies with touch. But they're also sensitive to temperature. And I want to all share with you is that one of the really great factors, if your baby is not preterm, if your baby is born what's considered full term, then your baby's usually going to be comfortable in about 1 extra layer than what you would wear for that season. Anything more than that, then they're often going to get over hot. Anything less than that, then they may be too cold. And of course, especially in the newborn period. So once they get more weight on them, they're able to adjust their body temperature a little bit better, but you will still go by kind of that guideline. So sensitive to touch. So I always want to talk about this because I think it's so important. When I'm working with a newborn for a mom in their home, I love to show moms and dads how to touch their babies and to watch how their babies respond to that touch. Babies have over 100 different reflexes, and they can react and respond differently to them. And so each baby is going to be a little bit unique, But one of the ways that I encourage parents to interact with their baby is either after a bath or during a diaper change, is to kind of start at the bottom. So start with their toes and their feet. And you may want to use like a gentle natural oil, like almond oil or something like that, coconut oil, and you can use that to help rub and massage your baby's skin. And just watch how they respond to that. If you have some infant massage classes in your area, you can take those. There's definitely books out there as well, but it's really nice to have a doula or infant massage therapist really show you some of those techniques. It's a great way to interact with your baby. It's a tool to bond with your baby. It's also a tool to calm your baby. And so if you help cue them into understanding that they're safe through touch, it's a really easy way you have as a parent to be able to calm your child. Oops. Okay. Moving on. I could talk all day. So let's talk a little bit about reading those baby cues. So it might seem pretty obvious, but reading some of your baby's cues can really prove more difficult than reading others. It takes a while to kind of develop that understanding of their unique signals in regards to things like crying, gas, hunger, fussiness, and illness, and other things. So I really love helping babies to kind of understand what their child is trying to tell them and show them. And sometimes just a couple hours in your home can really help you to really understand some of those things. Definitely we share those in our classes, our in-person classes, but babies really have not yet learned to communicate themselves. And so it's really so important to remember as a parent and a caregiver to learn how to recognize their cues and respond accordingly. But I also tell parents, give yourself grace. You're not going to know everything. You're not going to get everything right as a parent, newborn and through teenager. So it's a growing process. So no worries. But these cues can be subtle. So subtle cues for getting ready for feeding is just limb movements. I mean, okay, yeah, that's really going to tell me my baby's hungry, but yes, it can. But it can also be misread. Oh, my baby's waking up. I need to pick them up. But they're just going through a sleep cycle. So there's a lot of different things that really just spending that time with your baby and having somebody there who can help you to understand what your baby's communicating to you can be really helpful. So whatever it is, you can really be sure that by familiarizing yourself with your baby's patterns, you'll be able to respond to their needs accordingly and kind of in a more beneficial manner. So responding appropriately. And this is really why many doulas can really spend several weeks sometimes familiarizing themselves with a child or maybe a nanny that's in your home. They're really going to respond to those as baby's needs. It's really important that anybody that you choose to care for your baby is professional and accredited and has the right background to be able to care for your baby. So it is super important to understand that and really just understand that as parents, it's normal to feel kind of helpless and clueless when it comes to those cues from your baby. It is all new to them and to you. So just want to say that. And just trust your gut. All right, so colic. I'm sure you've had people come up to you and tell you about their experiences with their baby who had colic. My second child had colic. Hers was due to the fact that I had oversupply and she was very gassy because she was a vacuum when it came to breastfeeding, and she tried to swallow every last drop of milk that I had, which caused her to swallow extra air or overfeed, and thus she became colicky. As a parent, I was still trying to figure this out. So I didn't really figure it out, but it was difficult. And colicky babies are really babies who will cry for seemingly no reason for longer periods of like 2.5 to 3+ hours a day for at least like 3 days a week for at least 3 consecutive weeks, sometimes longer. These babies just have trouble settling. You've fed them, you've done all the S's to try to make them feel better, and it's just this crying episodes can be really hard. And so just it's basically very sort of like soul destroying, you know, these just intense periods of crying, accompanying oftentimes by like tightness in their abdomen, clenched fist, arching of the back, recoiling to touch, can all be sort of symptoms of colic. There is no specific conclusive causes of it, though I often think that as a doula that a lot of babies that I work with, and particularly my own, it often has to do with digestion. But of course, I am not a professional in the area of that, so I don't want to diagnose anybody's baby with specific things, but sometimes babies have reflux that's silent reflux. There's lots of different causes. So one of the things I do is to try to help parents who have colicky babies try to figure out what could potentially be the cause or just how to soothe that. So we talk a lot about that with our clients. All right. So babies and spitting up. Some babies are big spitter uppers. So there's a difference between spitting up and reflux. So let's talk a little bit about that. It is most widely known that spitting up is another like issue that you may be dealing with. And most babies spit up at some point. Some babies are more uppy than others. That's the term, spitter-uppy. So a lot of times if your baby spits up a lot, you're gonna use cloth diapers and burp cloths a lot and have those types of rags available so that you can clean up those messes, and you're gonna be doing a lot of laundry. Some parents use bibs to help with that, to help reduce the amount of times they have to change their baby's clothes. So how do you know if your baby spit up is reflux or just natural spit up? If the spit up is not accompanied by sort of an apparent pain or discomfort or distress, so your baby just kind of bubbles up and this milk kind of bubbles out of their mouth, and they're just like, didn't act like nothing happened, then it can be really normal spit up. And normal spit up can also be almost projectile vomit, like milk. Maybe they had an air bubble and it just came up. And this would be occasional, not like all the time. But sometimes babies that does happen. And then they're still like not in distress, not in pain. When your baby starts to display symptoms of being in pain while spitting up for a prolonged or consistent amount of time, it can be often something that you want to check with your provider about as what's considered GERD or esophageal reflux disease. If your baby has this, you do want to talk to your provider about it. Sometimes they recommend medications to help support this. Just depends on the severity of it. But we will talk a little bit more about things that you can do on your own to help support a baby if your baby has reflux. So symptoms of reflux could include gagging, choking, coughing, breath that's kind of like acidy and acrid smelling, excessive hiccuping, and also burping. So frequent spitting up or vomiting can be projectile or just a little bit. Also fussiness and trouble settling to sleep. So these are all key things to note if your baby is having trouble. Some more natural treatments or things that you can do is increase their healthy gut flora. So oftentimes your provider will help you with increasing the good bacteria, and probiotics can be really helpful sometimes with that. Oftentimes, nursing in more of an upright position for your baby can really be effective in helping reduce reflux symptoms, to keep that down. Also, to keeping them upright for about 20 minutes after a feed, or at least elevated with their head. They're less likely to be able to spit that up. Also, some moms who are breastfeeding may look at eliminating specific things in their diet, common things that could be causing baby to have an allergic reaction or be having reflux are soy, wheat, dairy, eggs. And you can take those out of your diet altogether if you want to, and then add them slowly back in to see what the symptoms are. Or if you feel like you have a history of your family history of being more sensitive to one of those, you may start with one of those. So always talk to your providers about that. Over swaddling, so too tight swaddling, can be in some way that you can help babies who have reflux. Just that extra pressure could be worsening it. All right, Cradle Cap. So Cradle Cap, or infantile seborrheic, I think that's right, dermatitis, is characterized by a varying degree of loose, scaly, dry patches of skin on top of the scalp. Natural remedies are really definitely preferable, I feel like, for a lot of parents to this treatment. Is a particular imbalance in your baby's sort of health and their biome, I guess, sort of system. As an external or very treatable issue, it makes sense to reduce the amount of the unknown substances that you give your baby, for sure. Cradle Cap is really easily treatable. Almond or olive oil are great ways to reduce the symptoms of Cradle Cap on your head, and you can rub it gently, leave it in, and then using a comb or baby brush, you can gently comb out the flakes with that, and the best way to remove those already existing, and just you want to gently do this, so not too hard, but just gently. If you're breastfeeding your baby while they're nursing is a really good way, because they're just totally calm, but you do want to make sure that you kind of remove that oil so it doesn't clog their pores and cause more buildup. So note that. If your baby has experienced Cradle Cap, and you still are unable to get it resolved, definitely talk to your provider about that. I'll send you guys some information about that in our email. All right, so next is diapering. And I do want to note, I'll just jump back really quickly here, that swaddling has come so far. There's so many swaddlers and different types of swaddling devices. I just want to note that babies should not be swaddled once they can roll over. Okay, hands should be out. It's a safe sleep protocol. That happens around 3 months. So if your baby does it is it earlier, just be watching them, because if they can roll over, they need to be able to have their hands out so that they can press their head up. Okay, just a really important note with that. And that's why you'll notice that swaddlers come in just small and medium, just those two sizes. Excuse me. So let's talk a little bit about diapering. There are really a number of causes for diaper rash in babies, and really not all of them may be obvious. While most all babies really experience diaper rash at some point in their early months, it can vary really extremely as such as with any illness, really, and should be treated accordingly to that individual's need. It's experienced as a sort of a red or raw rash, usually in the diaper area. Sometimes raised, sometimes not. It can cause much discomfort, itchiness, and even pain. So if they urinate on that, it can sometimes burn. Some natural care products to help relieve it. So trying to switch brands of diapers is often a really good protocol. It could be whatever brand you're using contains something. Your baby may be extra sensitive or allergic to it. And so before seeking professional help, that's a good thing you can do just on your own. Coconut and olive oil, rubbing these natural oils will often help soothe itchiness. Coconut, extra virgin organic coconut oil contains antimicrobial, and I think it's antimicrobial and antibacterial qualities to it. So it does have sort of a healing and protectiveness. Baking soda, this is something that I use with my babies in the water, sprinkled in the bath water, can help relieve the acidity and that urine or excrement buildup of the diaper. So let's see, another antacid can help is apple cider vinegar. So using sort of a damp cloth, gently rub the affected area to soothe the symptoms too. Breast milk is so good for so many things. It can also soothe things like your baby's diaper rash. We also recommend using breast milk sometimes to help with those clogged ducts in the eyes. It's easy to be able to apply that to your baby. It's a natural thing that happens to a lot of newborns, is that their tear ducts don't clear really easily on their own. And so a lot of pediatricians and doctors will tell you to take your pad of your index finger and rotate it towards your bridge of your nose to help that release and help that drainage. But you can do that after putting in breast milk into your baby's eye. Also, if they have a stuffy nose, breast milk is really good for that too. So that does definitely contain that antiviral, antibacterial qualities to it. Moms, if you're breastfeeding, breast milk on your breast can help if you have any soreness or damage to your nipples at all. All right. Let's talk about bathing. We mentioned this a little earlier when we were talking about Cradle Cap. So if you're really hoping to make sure your baby is completely taken care of from day one, it's really important to consider what you're using, what products you're using on your baby and your baby's laundry. Some hospitals do use things that contain chemicals and fragrances in them to clean your baby. I often tell couples, if you want to use something different, take it with you and pack it in your hospital bag. So just note the more ingredients listed on any kind of product, whether that's a food or a household product or a cosmetic or product for our bodies, that's a good sign that there are probably things in there that are not helpful for you. But washing baby can kind of remove things. So if we think about that newborn bath, you don't really have to wash baby while you're at the hospital if you don't want to. Babies are definitely wiped off to make sure that they do not have any type of moisture on their skin that could cause them to not regulate their temperature. But babies really don't get immersed bathed until after their cord is dried off and fallen off. And so we really just want to spot bathe baby as needed. Not pediatricians, but dermatologists really don't recommend using soap on babies for like the first 6 months because baby's skin can be so sensitive to different types of substances in baby in soaps. So when babies are first born, they have sort of this vernix often, especially babies who are born kind of early. And this is a sort of a thin layer of skin which protects baby's skin from that in utero water. And it contains a lot of beneficial properties, including antimicrobial, defending baby against infections, and sort of has a moisturizing effect. So just something to know. It's so beneficial, really, vernix is, that many skincare companies have researched the product, which provide these protective factors. So your midwife or provider may tell you could delay that first bath for as long as possible to help ensure that your baby gets skin gets the maximum benefit. It's really a matter of personal choice, really, but including your preference on your birth plan to note what you prefer is really important, I think. All right. Okay, so diarrhea. Sorry, this is misspelled. As babies suffer from diarrhea, really, at some point in their first year, they often will. If they don't, that's awesome. I hope they don't. I hope that we can prevent babies from having this. But their bodies have to become accustomed to digesting new foods, right? So the important thing to note is when treating this imbalance that if it becomes prolonged or extreme, it's definitely something you need to check in with your doctor about. Now, diarrhea, when we talk about breast milk stools, they're really liquidy. And diarrhea often in babies is kind of frothy, sometimes green, just looks not typical. So you'll kind of learn what's typical for your baby, and when it goes off of typical, then definitely reach out to somebody about that to make sure that things are okay. Breast milk really contains numerous nutrients that numerous valuable nutrients, and they help protect the body, baby's body, against that. And it also replenishes your baby's health, and breast milk during this time helps baby stay hydrated and all that stuff. So you still really the best food for your baby. Probiotics can offer a similar support to baby's system, making sure that they have the correct types of flora in their gut to be able to fight off. So probiotics and prebiotics are really important. All right, so you can ask your provider what they might recommend. Sometimes blander foods, so if your baby's eating solid foods and they have mild bouts of diarrhea, sometimes starchy foods such as white rice, mashed potatoes, or bananas can be helpful to slow that diarrhea process. And similar foods containing too much sugar can have sort of a negative effect on diarrhea. So, all right. Let's talk next about sort of some recipes for natural baby care. There are really a number of products that you can make to use at home for your baby that use all natural types of products. These include natural diaper creams, natural baby oils, shampoos, conditioners, and baby powder, as well as natural deodorants, cosmetic products for yourself. So really, the fewer ingredients often are less likely to cause problems, like I mentioned before. And the benefits of creating these products in your home is that they are personalized and readily available, as well as giving you peace of mind that they will not harm your baby. So I will send y'all some information about some recipes that will help you in the email that will follow this. All right. Environment in the early days. So this picture here, guys, does not show safe nighttime sleep. This is like a trick question or trick picture. If you were around your baby during the day and you're awake, putting a blanket across your baby that you're going to be monitoring is fine if you were there watching your baby. However, otherwise, nothing should be in the bassinet besides your baby and your baby's swaddled, so a swaddler or a swaddle blanket that is swaddled, nothing loose. So environment really in that immediate period of your baby's birth should be covered in your birth plan. It's often important to talk about that. And also in just those early days following sort of that initial entry into the world are also equally important. And that fourth trimester should ideally take place within a steady environment. The less shifts or transitions, the better. The more changes that take place, the harder it will be for both you and your baby to settle sort of into that routine. So for the first couple weeks, good things to think about are limiting visitors to a minimum, and those visitors that do occur to keep them short. You can often preempt this time by sending out a wonderful, loving email or a message to family and friends to let them know that you are super excited to share your child with them, and that to note that we will be limiting those visits to help ensure recovery for mom and babies thriving. So the one thing to note is just even short visits in those first couple days and weeks can really tire out mom and baby. And it's just a crucial stage. It's important to make sure that visitors and their children wash their hands before meeting and greeting baby and mom. Making sure that you limit any type of smoke. If you have somebody who's a smoker, make sure they take off their jacket because you don't want to get that secondhand smoke. Maintaining a temperature comfortable for a lightly clothed adult. Ideally, nursery temperature is generally around 68 to 72 degrees. So I'll send you some more links and stuff about sleep. We cover a lot of that stuff in our early postpartum class. So check out our website for those upcoming dates. All right. All right, importance of routine. So every family is going to be very different on how their family works best. Some families work really well with sort of a really more of a mapped out schedule. Some work well with sort of more of a loose routine, and some work well with just kind of like watching baby and following baby. So one thing to note, and we talk about this in our early postpartum classes, understanding baby sleep-wake windows so that you can understand how much time you have before baby is really going to need to go to sleep and what needs to happen in those times. So really, sometimes routine can help you to be able to care for baby. So in those early days, it can be help you to have some successes. And routines often are patterned by what you notice is sort of like happening naturally. You know, what time is are naps occurring? What times are normal feeds taking place? When are you fitting in personal care? When am I able to get that shower, sit down and eat a meal, have personal care, take that extra nap that you need from all that lost sleep? So you'll kind of figure what's happening out with that, but it's sometimes really challenging to do that at the same time you're learning everything new. So at Hackager Doulas, we do a postpartum planning session to help parents kind of understand what to expect and how to map out what that might look like for them. And that really helps them to transition more smoothly into that postpartum period, especially if you're a first-time parent or possibly expecting twins. Okay, napping. So mom and baby love being together. They also love being with dads. But napping is so, so important. And any new parent learns really quickly how crucial napping is. That most important S word, sleep. If your baby isn't getting sufficient sleep, chances are that you are not either. So that's sort of a balance. When one person is not getting adequate sleep, likely the other person is. And really the effects of sleep deprivation can be felt throughout all elements of your day. And for baby, it means that disrupted sleep patterns will make it even more difficult to settle into any routines, regulate things such as digestion or growth. If your baby isn't napping regularly, you should be working with somebody like a doula or somebody to help you figure those types of things out. This is so, so important and should really take priority. I would say that I work with a lot of moms who are dealing with postpartum distress and mental health issues, and their number one issue is often sleep. Sleep can impact so much. It can impact mom's recovery. It can impact her coping, and also dads, because when babies aren't sleeping, it affects the whole family. So if you're if you're needing help with that, definitely reach out to us. We can definitely help you to consider some options, some adjustments that might help it and just help you to learn your baby and to soothe baby. We all have different things that we're really good at. And, I always say that my mom was never really good with babies, but she's amazing with like adolescents and teenagers. So you will notice as you raise your children that there'll be times when you feel more comfortable as a parent and less comfortable sometimes. So always reach out to people who can help you with that. The following things really can negatively impact your baby's sleep patterns at night. Catnapping. So catnapping would be like short naps that are less than 20 minutes. Sickness, vacations or disrupted routines, or no naps at all. Various things, sometimes therapeutic grade essential oils, massage techniques like we talked about have been known to help get newborns soundly to sleep, yet simply achieve this for them. And lots of things is just kind of understanding your baby and your baby's cues. I don't really recommend adding other things in unless it's super essential or unless you're comfortable with that. So baby sometimes just gets off and that pattern can continue negatively. So it's really important to try to work on recorrecting that as soon as possible. All right, so mom's health is so key. When mom is happy and healthy, it creates more calm and ease within the family. And while all of this sort of fussing and stressing is going on to ensure that new baby has optimal health, it is really important not to forget about you. This things like fatigue, respiratory illness, postnatal depression, and anxiety, obsessive compulsive disorders, disrupted sleep patterns are all common in new mothers who have lost sleep or not enough sleep. And it is really vital to take care of your health as you assimilate into your new role as that parent. Ensuring that you have proper nutrition, rest, sort of a gradual re-assimilation, whether you are needing more adult interaction or you like to stay kind of tucked away. Listen to yourself and try to hear what it is that you need. Partners, it's really important for partners to be aware of what's going on because they know mom's best, and it's really important for you to speak up if you see that things aren't going well. Speak to her about it, and then also reach out to help get that support that you need so that you can rewrite that ship. So don't sell yourself short. while all the attention is really focused on the new baby, make sure that you get time for yourself. Awesome. So any questions? We're really kind of finishing up and wrapping up, and I just wanted to check in and answer those questions. So I'm going to take us off of screen share and see if you guys came up with any questions while we were talking about those natural newborn care options. Feel free to leave any comments. I will have this sent to you via email if you registered for it. So tell me kind of what topic was most interesting, things that you might want to know more of. Thanks so much, guys, for being here tonight. Again, I'm Allison, doula and health coach and co-owner of High Country Doulas. Thanks so much for being here. Hope that you have enjoyed this, and I'll be here to answer any questions for you. So if you don't have any questions, good night, and I hope you see you soon. Awesome. Oops. Stop the share. All right. So all right. I'm trying to scroll down through here. When you have time, can you recommend a whole foods-based vitamin or iron supplement? Iron supplements, the ones that I know of that are whole foods based, are made through Gaia Herbs and Floridax. The whole foods based prenatal vitamins that I'll recommend, I can email those to you, Mandy. I have your email, so I can send those to you. There's several different companies out there. I don't want to tell you the wrong one. I know what they are looking at them, but I can't think of the names right this second. So, all right. Did I answer any other questions? Awesome. Oh, Kayla. Yay, your baby girl's due October. So you've got a lot of time to like learn all kinds of things. That's awesome. Congratulations. I hope you have a wonderful summertime and find lots of water to get into. So to cool you off. Gummy vitamins. So yeah, there is a couple companies, Mandy, that does do gummy vitamins that are more of a whole foods based. They're not, of course, the most whole foods because of the way they have to do to get them in gummy vitamins, but they're pretty good. So I will send those to you. I will make note of it right now and email those to you. If you think of any other questions that you might have that come up, feel free to email me. I'll be happy to share with you some resources for that. Yay. All right. Well, thanks again so much for being here tonight, and you all have a wonderful rest of your week. And just know that High Country Doulas is here if you have any questions. All right. Thanks so much. My camera's all funky. Good night.